Welcome everybody to our engagement event that's being hosted by Cymru Morgannwg Health Board today. I'm just going to give a couple of minutes for people to have the opportunity to join us. Following that, then I'll go through some rules of how the event's going to run today. And then it'll just be a short presentation and an opportunity for questions. But for the moment, we'll just give a couple of minutes for everybody to join the event for any latecomers. Thank you. So we'll just give one more minute for people to join us, and then I'll start introducing the rules for today's engagement event, how the event's going to operate, a little bit of introductory information. So just one more minute. Okay then, welcome everybody it's the first of our public engagement events hosted by Cymru Morgannwg University Health Board on the South East Wales Vascular Network. So first and foremost, I'm just going to ask whether anybody attending the event today would like it translated in Welsh. We have made available a Welsh language translator. So if anybody would like this translated in Welsh, if you could let us know in the chat bar, please, that would be really helpful at the moment. If there is no one that would like the event translated in Welsh, then we will let the translator leave. So I'm just going to give a moment to see if anybody wants to put in the chat bar if they'd like it translated in Welsh. Okay, I haven't seen anything come through, so I'm going to presume then that nobody would like this translated in Welsh. So thank you, Ben, for agreeing to attend the event today and supporting us with the Welsh language translation. But as though you're not required for this event, so thank you.
Okay, diolch yn fawr. Thank you. Bye. Bye.
So I'll move now into today's event. So this is a public engagement event for the South East Wales Vascular Network. So we're going to open up with a short presentation. It won't be too long because we really want this to be an open event with the opportunity for discussion and questions. Any questions that you do have, we're going to ask that you type them into the chat bar. And what I'll be able to do then is, once we finish the presentation, I'll be able to facilitate those questions, fielding them out to the most appropriate person to answer those for you. And just to let you know as well, the event is being recorded. So this means that the event will be available for others to view and see afterwards. I'm actually using 2 screens today to be able to do this presentation. So when you see me looking off to the left, it's not that I'm ignoring you or I don't care. It's just me reminding myself of the content on the slides today. So hopefully that's all okay for you. So I'm going to just move this into the presentation now. So the agenda for today, so welcome and introductions. So that's where we are at the moment. Then we're going to go through our aim for South East Wales Vascular Network, who is involved. Then I'm going to hand over to Kevin Conway, one of our vascular surgeons, and he's going to talk us through what are vascular services, how are vascular services provided now, why are we talking about it now, how do we do and propose model of care. And then I'll close off then with some further information of how you can get involved and we can hear your views on this. And then the final part will be the question and answer session where we'd love to hear any questions from you. So please put those questions into the chat bar. You can put them in at any point while I'm presenting, just as they come to your mind, and then we can deal with them at the end of the presentation. So firstly, I'll introduce our panelists today. So Mr. Kevin Conway, would you like to introduce yourself?
Hello, I'm Kevin Conway. I'm a vascular surgeon in Cwmtaf. I'm also the clinical lead for vascular surgery in Cwmtaf and Cardiff and Vale.
And then Stuart.
Hi, I'm Dr. Stuart Hackwell. I'm locality group director. I'm responsible for healthcare delivery in the Rhondda Taff Ely locality of CTM UHB, and I'm also a GP in CTM. So
then myself, I've just realised that I've made the criminal error of not introducing who I was when I started this presentation, so apologies for that. I am Mary-Claire Griffiths, chairing the event today, and I'm the Assistant Director of Strategic Planning and Commissioning in the Health Board. And then Hannah. Hannah, are you there to introduce yourself? So I think that's probably our first IT blip of today's event. Hopefully there won't be too many more, but we do have Hannah Davis with us, who's a physiotherapist in the team.
Can you hear me now?
Oh yes, we can, Hannah. Great.
Sorry, that might have been my headset. My name's Hannah Davis. I'm a clinical specialist physio with Cwmtaf, working for the vascular team, delivering their intermittent claudication programme.
Great, thank you, Hannah. And then finally, Lee.
Good afternoon, everyone. My name is Lee Leishan and I'm the Assistant Director of Engagement and Communications at Cwmtaf Morgannwg UHB. Fairly new into post still. I joined the organisation back in the autumn. So this is my first public engagement event today, so very much looking forward to learning more about how we engage in Cwmtaf Morgannwg and keen to take on board any feedback and learning in terms of how we develop this going forwards. Thank you.
Thank you, everybody. So we are your panel for today. So this is an engagement opportunity that's been jointly led by all of the health board organisations that secure vascular services for their population. So we're looking at the South East Wales region, so that involves the Nair and Bevan University Health Board, Cardiff and Vale University Health Board, Cwmtaf Morgannwg University Health Board ourselves, and Powys Teaching Health Board. So the populations affected that we're discussing are Blaen y Gwent, Caerphilly, Monmouthshire, Newport and Tyne, Cardiff and Vale, Glamorgan, Rhondda, Cynnon-Taff and Merthyr. So just to note that Bridgend is part of the South West Wales network, so isn't part of what we're discussing today. And then South Powys as well. Other parts of Powys are served by the South West North Wales networks, as well as networks in England. So Stuart, did you want to take us through this slide?
Hi, thanks, Mary Claire. So this is really about starting a discussion with everybody who would be affected by these service changes across South East Wales and how we organise our vascular services. So we're going to just take you through with a lot of this is with the help of Kevin, but this is around what vascular services are, who would actually need vascular care in our communities, how we provide them at the moment, and any problems with how that is, what's happening with that, because we then talk about the challenges that is proving, challenges that we have in terms of providing those services, what the options we've started to consider in terms of how we could improve those services and improve patient outcomes and sustainability of the service, what the preferences may be in terms of how we organise those services, and then what the advantages and disadvantages of any future changes would be should we take those forward. So I'll hand over to Kevin next to take us through the rest of it. Thank you.
Thank you, Stuart. Yeah, everybody wonders what vascular surgeons do. So essentially, we use operations to deal with the diseases of blood vessels, and by diseases we mean narrowings, blockages and dilatation, or I'm sure most people have heard the term aneurysm. And the reason we do that is to try and restore the blood flow to the limbs and organs and prevent potential catastrophic complications, which can result in sudden death, strokes, and sometimes loss of a limb. And what we really want to do is improve people's quality of life and the function that can be got by increasing blood supply to limbs and to organs. Next slide, please, Mary Claire. So what are vascular services? So essentially, what people think of is trauma. Luckily, in this part of the world, damage to blood vessels is actually quite rare. What is much more common is the diseases caused by diabetes, smoking, and increasing age. Therefore, we have very close working relationships with our colleagues, particularly in trauma surgery, the cardiologists, the heart doctors, but also the diabetic, stroke, and kidney specialists. Next slide, please, Mary Claire. So, who needs vascular services? Well, essentially anybody can need vascular surgeons at some stage during their lives. Obviously, if you injure a blood vessel, that's not good. We need to stop the bleeding, we need to repair the blood vessel, and we need to get the blood back to where that blood was supposed to go to before. That's actually not a particularly common part of our practice. What's much more common is dealing with narrowings and blockages in arteries, especially in the neck, because if we don't do that, the patient can go on to have a stroke. But also to the arms, legs, the guts and kidneys. Next slide, please, Mary Claire. So where are the services provided currently? Traditionally, going back to the 1950s and 60s, nearly every hospital that provided surgery did vascular surgery. There was no such thing as vascular surgeons in those days. It was general surgeons who provided a pretty good service. But by the 1990s, it was becoming clear that the outcomes from big units doing lots of vascular operations was much better than small units doing infrequent operations and those done by general surgeons. So the Vascular Society, which is our overarching governing body, advised all the regions in the UK and Ireland to pool local resources. So in South East Wales, we concentrated our vascular services in each health board into a single hospital. So in Cardiff, it was University Hospital of Wales. In AB Health Board, it was the Royal Gwent Hospital, but as of a few months ago, all of the acute services have actually been moved to the new hospital, which is called the Grange University Hospital. And in Cwmtaf, we moved all of our services to the Royal Glamorgan. Next slide, please, Marie-Claire. So why are we talking about these? Well, we actually have lots of challenges in vascular surgery. The biggest one for us, and for me in particular, is recruitment and retention of surgeons, radiologists, vascular nurses, but it's also the other specialists like physiotherapists and occupational therapists. I've already mentioned the Vascular Society, which is our governing body. It sets national standards for what we should achieve as units. One of the big ones is that we have to serve a population of at least 800,000 people. None of the three units in South East Wales cover a population that large, and therefore it's a driver towards centralisation of services. We know our services are spread too thinly. We don't have enough of anything when it comes to staff in any of the three sites. Despite this, our outcomes are good, but they could be better. South West Wales and North Wales have already concentrated their services on the single sites, and we'd like to do something similar to them and the rest of the UK. Next slide, please, Marie-Claire. So how do we do? As I mentioned, I think we do quite well, and the reason I know that is that all of the procedures that vascular surgeons do, excluding varicose veins, have to be submitted to what we call the National Registry, or the National Vascular Registry. And there's 5 main operations that we do that we have to submit our information on, so that we can compare ourselves from year to year between units. And those procedures, the 5 key areas, are aortic aneurysms, which I've already mentioned is a dilatation or a ballooning of the main artery in the tummy. Carotid endarterectomy is the artery going up to the brain can get furred up, and if we don't unblock that, the patient can go on to develop a stroke. Leg bypasses, which is by far the commonest operation we perform. This is where narrowings and blockages reduce the distance that people can walk, but also if it gets particularly bad, they can actually go on to lose that limb. Angioplasty is a keyhole technique performed by our radiology colleagues, where they insert a balloon on a wire through a needle into the narrowing or blockage and can open that up. And unfortunately, some of our patients do go on to develop amputations of limbs. And again, it's very important for us and for the Vascular Society to know how often we're performing amputations, why, and how well those patients do afterwards. And if you want to see my results and all of my colleagues' results, you can go on the website listed below. Next slide, please. The title of this is Our Doctors Have Been Talking About This Service for Some Time. I've personally been involved with this for several years, going back to 2013. I've said our results are good, but we want them to be better. Doing this, we'll come into line with the rest of Wales and the rest of the country, and actually North America and Europe, which has also done this. It'll also help us to make best use of our existing workforce, which will hopefully improve our recruitment. And actually, since we've started this process, we've actually appointed a new surgeon back in January. He trained in the West Midlands, and we're hoping to appoint another colleague, sorry, a vascular surgical colleague after Easter. Next slide, please. I mentioned that I've been involved in this process since 2013. My colleague Richard Whiston has actually been involved in this process since 2001. It's taken an awful lot of work for us to get to this point. Back in 2014, we had what's called an options appraisal, where a large panel of co-workers from each of the 3 health boards got together, and we looked at all of the options available to us for improving vascular services. Next slide, please, Marie-Claire. So we had lots of presentations with regards to the options. We had 6 that we looked at, and we came to a collective agreement. We decided as a group that it would be best to have a central hospital, which we called the hub hospital, where we would do the big operations, but also to utilise our spoke hospitals in each of the health boards, so that patients could be rehabilitated closer to home. So what this means for patients is that when they come to hospital for surgery, it'll be done on a single site. So as we said, that concentrates our services and hopefully improves our outcomes. And then following the surgery, if patients need more time to recover, they can be rehabilitated in a hospital closer to home. This makes best use of our skills and of the staff available. And we know from the experience of all of the other units in the UK and from North America and Europe that this improves outcomes for our patients. Next slide, please. The process of the options appraisal was very rigorous, and it was very fair, and it was unanimously agreed that the hub site should be in the University Hospital of Wales, and the main reason for that was the other services already located there, namely the dialysis, the renal dialysis units, neurosurgery, and the radiology department. And since we did the options appraisal, the major trauma centre for Wales was opened in University Hospital of Wales, and I think this sort of reinforces that we made the right decision at the time. Next slide, please. So what about the spokes? We agreed that each health board should maintain a spoke. When we did the options appraisals, the Grange University Hospital only existed on paper, so it was agreed that initially it would be the Royal Gwent for the AB Health Board, but subsequently with the moving of acute services to the Grange, that is now their primary spoke. In Cwmtaf, it's going to remain the Royal Glamorgan, as we previously agreed, and in Cardiff, the University Hospital Clondalk has been picked as the spoke for Cardiff. And this just means that rehabilitation will continue to take place through your local hospital across the regions, and hopefully patients will be closer to home during that rehabilitation recuperation period. Next slide, please, Marie-Claire. So what does this mean for you as a patient? Initially, it means that you will still attend, if you have a vascular problem, your local A&E department as you would have done before. You'll be assessed by the doctors there, and if it's deemed that you need to have help from the vascular surgeons or the vascular specialists, then you'll be transferred to Cardiff to the University Hospital for that treatment. Following that treatment, if you're not well enough to go home after the surgery or procedure, then we will transfer you back to your local spoke hospital for recuperation and rehabilitation. Next slide, please. Okay, I think it's over to you, Mary Claire.
It is.
Thank you.
So this presentation was a summary of a much sort of larger piece of work, but we've tried to condense it down into a few slides to have a good discussion with you today. But if you are interested and want further detail on this, it is available via our website. We'd really like to hear your thoughts on the information that we have shared. So please put any questions that you might have into the chat bar, and we will do our best to answer them for you today. So there are some frequently asked questions that we're happy to share with you and discuss, but please tell us anything that you would like to know, and it doesn't have to be based on the presentation that you've just seen. If there's anything that you wanted to know, please tell us and ask any questions that you've got. So we want to hear your views. We want to hear your views on the recommendation that a hub and spoke model will improve patient outcomes, the proposal for the University Hospital of Wales and Cardiff to be the hub, the suggested spoke arrangements that we've outlined today, any further information that we should consider in deciding the future of vascular services, the process undertaken to reconfigure services, and any alternative view on the proposals put forward. So those are the areas that we'd really love to hear from you about. But again, if you've got anything else that you would like to share with us or any other questions, then please do so. So you can do that as part of the event today, but also you can visit our website. There's some further detail there. And we've got an email address set up specifically for this, so we can receive any questions on that, and also a dedicated phone line for this where you can leave a voicemail message with your question, query or thought, and we'll make sure that it's captured as part of this public engagement. And if it was a question that needed to be answered, we can make sure then that we get the right and best person to contact you back with the answer to your question. And you'll also see the hashtag South East Wales Vascular on social media, and that's how all the organisations are sharing information on social media about this. So lots of different ways that you can contact us, and we do really want to hear from you. So that's the end of our slide presentation for today. So really this is the opportunity now for any questions, any thoughts or comments that you might have, please put them into the chat bar. Okay, great. So I can see that there's a question around 2 spokes and an Iron Bevan, and whether that is still valid after the changes in Royal Gwent as a result of the Grange opening. So Kevin, I'm going to ask you to answer that question if that's okay.
Yeah, my understanding, I spoke to my colleague David Lewis in AB yesterday about this. Although the original options appraisal said there should be a single site, a single spoke in each health board, it's slightly more complicated because of the way that the Grange University Hospital is set up. It's actually a specialist care centre, so that means that it has only emergency services. So it's got the emergency unit, it's got the operating theatres, it's got the critical care unit, but it doesn't have all of the rehab and outpatients facilities that the Royal Gwent Hospital had before. So it's not a straight answer. My understanding, at least initially, it will be spread across both the Grange University Hospital and the Royal Gwent.
Thanks, Kevin. Just so if that didn't answer your question, please put a follow-up into the chat bar as well, and we can see if there's any further detail that we can provide you on that. Also, any other questions from anybody today that they'd like to share with us, or even just thoughts and reflections? If you would prefer, please put those into the chat bar, and we can share them, discuss them, answer them. Okay, if there's no further questions that are coming through, I'm happy to talk through some of the frequently asked questions that we've put forward as part of this exercise, so I can highlight any ones of those that we haven't already picked up in the presentation today. Okay, so question number 2 in our frequently asked questions is, what is a vascular network? So the aim of a vascular network is to improve patient outcomes and ensure that services are sustainable and equitable for the population that they serve. A vascular network provides a coordinated vascular services for a population across a wide geographical area and involving a number of different hospitals. Vascular services across NHS England, North Wales and West Wales have already been reconfigured into network models of care for a number of years. Most networks operate a hub and spoke model of care, as we've discussed today, which focuses on major, urgent and emergency vascular surgical procedures to be performed in one specialist hospital, which is usually called the hub, whilst minor procedures, investigations, assessments, recovery following surgery and outpatient appointment can still take place in local hospital, the spokes. So what is the difference between a hub and a spoke? The crucial differences between a hub and a spoke are the seriousness of the conditions treated and the complexity of the procedures undertaken. The hub receives all vascular emergencies requiring vascular or endovascular intervention, along with all vascular inpatient urgent care. It has dedicated vascular inpatient beds and a ward staffed by nurses with an interest in vascular surgery. A spoke hospital provides everything other than complex and emergency vascular care and has no dedicated vascular hospital beds. Oh, I can see while I've been talking then that we've just had some further questions. So for those patients who do not use IT or social media, how can you gain their views? So I'll initially answer this and then just Lee come in if there's anything further that you wanted to say. So we have developed posters as part of this campaign as well, which we've tried to put in some key places, including the mass vaccination centres. And also we've had screens put up in GP surgeries with this information. And all of those contain the phone number that I mentioned earlier in the presentation, so that we can make sure that for those who don't use the IT or social media, that they're able to make that contact with us by phone so that we can get their views. Lee, is there anything that I missed that you wanted to add to that?
Thanks, Mary-Claire. In addition to that, just to remind everyone about the telephone line where voicemails can be left as well. But obviously we're happy to take any comments, any feedback through any mechanism. So if anybody wanted to write in hard copy, traditional snail mail, then obviously we would make sure that that would that reaches our colleagues who are involved in this piece of work. So equally, we're keen to hear about any ideas, any suggestions that you may have, if you wanted to detail that in the chat bar, about how we can gauge opinion and any other conduits to that information reaching us, that feedback reaching us. We would welcome that, absolutely. Thank you.
Thanks, Lee. So then another question that we've had is, which parts of POWIS does this affect? So again, I'll give an answer to this question and bring Kevin in just in case I've missed anything. But it primarily affects, for this change, the South POWIS area, because that's the area that at the moment receives its vascular services through a Nyren Bevan University Health Board. Other parts of POWIS are served either through the southwest or the north of Wales, and also England as well. Kevin, did I miss anything there?
No, I think that's very comprehensive. As the network representative, I met the POWIS Teaching Health Board commissioners last week. We are currently just looking at South POWIS, but we're looking at the potential to cover as far west as Ostragunlice and as far north as Clanbridnod Wells. But that at the moment is just discussions. But going back to your answer, I think primarily it's southern POWIS that we cover.
Thank you. So I'll just open it up there just to check that we answered both of those questions for you. So if you've got any follow-up points that you wanted to bring in, please put them into the chat bar. Or if there's any other questions that you wanted to share with us, or thoughts and reflections, then please do so in the chat bar. Okay, I can't see any other questions coming through at the moment. I'll give you some time to think about if you have any others by just going back to our frequently asked questions again. So just looking through to make sure I don't pick up any of the questions that we've already answered as part of the presentation. So question number 5 in our frequently asked questions actually picks up how many patients will these change affect. So the total number of patients that it's likely to need a vascular procedure across South East Wales is approximately 1,250 a year. This estimate is based on the numbers from the year 2019, because activity levels were affected in 2020 by COVID-19, so we didn't want to use those figures. They wouldn't be an accurate reflection. In 2019, 456 patients were treated at the Royal Gwent Hospital in Newport. 355 patients were treated at the Royal Glamorgan Hospital in Llantrisson, and 437 patients were treated at the University Hospital of Wales in Cardiff. So will I have to travel further for treatment? So if you live in the area of South Powys, with your nearest emergency hospital being the Prince Charles Hospital, Merthyr Tydfil, or the Grange University Hospital in Cwmbran, the answer is potentially yes, but only if you are undergoing specialist or complex surgery, and only for the surgical part of your treatment. For the rest of your tests, treatment, recovery and appointments, they will not change, and they will happen where they do now, in a hospital that is more local to you. Oh, I can see some further questions have come through now. That's great. So what are the implications of the Welsh Ambulance Services Trust? So we've been in conversation with the Welsh Ambulance Services Trust to make sure that they're involved and engaged with all of the plans that we've been undertaking. There may be some implications on patient transport, but these will be able to be predicted and managed in a much more predictable way than maybe could be at the moment, and we'll be able to do robust demand and capacity planning with them so that they understand any implications on them. But as you can see from the diagrams that we discussed, we will be looking to support patients to go back to their home for recovery in the first instance, but if they can't, then a local hospital. So there would be some impact there with Welsh Ambulance Services Trust in terms of that patient transport, but we're engaged with them and in conversation with them on that so that they would be prepared for any changes that could happen. So I can see a question there. So yeah, so just a comment there from Adrian Osborne, so that the pathways for Ystrad, Gunlais and Llandrydnog Wells patients are not affected by these proposals. Their pathways remain unchanged. So thank you for confirming that, Adrian. So I'll just open it up again now for any further questions that anyone might have. Okay, I can't see any further questions coming through at this time from attendees, so I'll go back to the frequently asked questions to see if there's some further information that we can share that will be useful for you from there, and give you the opportunity to think of any further questions or comments that you might have. So you might ask the question, why do vascular services need to be changed? So we want to make sure that we provide the best care possible for people needing vascular surgery in South East Wales. And we know that vascular surgery is becoming increasingly specialised, and the evidence shows that patients have better outcomes if they receive their treatment at larger specialist centres. The Royal Surgical Colleges and the Vascular Society of Great Britain and Ireland support the view that it is no longer desirable to provide urgent or emergency vascular surgery outside a fully centralised service or formalised clinical network, with a designated single arterial centre providing a 24/7 on-site service. A lack of specialist staff to cover the existing vascular units means that we cannot always deliver these services safely, the way we have done in the past, and provide opportunities for staff development and training that other centralised vascular services can. Okay, no further questions have come through, so I'll just go through a couple more of the frequently asked questions. So we've mentioned this, but we haven't gone into great detail. So how do vascular services work elsewhere in Wales? So the population of North Wales, they are served by a network with Ysbyty Gan Clwydd in Rel as the hub, and the vascular clinics, investigations, diagnostics, vascular access and varicose vein procedures are provided by 3 spoke hospitals in the Betsy Cadwaladr University Health Board. In the South West Wales, the population is served by a network which has Morriston Hospital as the hub, and spoke services are provided in several hospitals in Hywel Dda and Swansea Bay University Health Board areas. It's just also important to note that South West Wales network does provide the care for the residents of our Bridgend population in Cwmtaf Morgannwg. Okay, no further questions have come through. So I'll just say that we do still really want to hear from you. We do want to hear any questions or thoughts or comments that you might have, so please share them in the chat bar if you do have them. But also to note really that if you didn't want to share them as part of this event, or you think about them afterwards when you've left, then you can still contact us. We'd still love to hear from you about this. So you can either visit our website, which has information on this. So that's www.cumtaffmorgana.wales and then /SE Wales Vascular, all as one word. And you can also, as Lee said, if you want to write us a letter, more than happy to receive a letter on that. So please send them to us by the 16th of April. You can also email us at sewales.vascular@wales.nhs.uk. And we do have our phone line available as well, where you can leave a message for us on 02921 836 068. Oh, great, another question's come through. Is there any impact of COVID recovery on the proposals? We are all aware of long waiting lists after the pressures of the last year. That's a really good and poignant question. Kevin, I'm going to ask you to come in on this one.
We don't expect to have any impact. Vascular tends to be an urgent and emergency service. So if you need to have an operation or procedure, we usually do it within a few days or weeks. We don't tend to have waiting lists, so I don't think this will be impacted by COVID.
Thanks, Kevin. So if you've got any follow-up to that question that you wanted to ask, please put it in the chat bar. If Kevin didn't cover exactly what you were looking for there, please let us know. Okay, I can't see any further response coming through on that one. Okay. So I'll refer back to the frequently asked questions and see if there's any other helpful information that we can share with you there. So some of you might be thinking about what happens next after the engagement exercise. So when this engagement exercise has ended, we will consider all of the feedback and we'll share this with the individual health boards and the relevant community health councils. We will also publicly make available of a report that outlines a summary of comments, questions, suggestions that have been received. We will consider all of the issues and whether there are any mitigating actions that need to be undertaken. And we'll also use the information received to update the Equalities Impact Assessment. And then subject to further discussions with the community health councils, we may wish to enter a period of formal consultation. And should we do that, we'll once again invite you to hear your views and thoughts on the changes that we're proposing. Oh, another question's come through. Great. Can you please clarify who will undertake the follow-up outpatients appointments and where these will be undertaken? Kevin, do you want to come in on that one?
Thanks, Mary-Claire. We'll endeavour to do them in your local spoke hospital, but sometimes, especially if there's complex wounds, that might not be possible and they may have to go to the hub. But I think most people will be seen in their spoke hospitals for follow-up.
Thank you, Kevin. So again, if you had any further comments or thoughts you wanted to share, if that didn't quite answer your question, then please put it in the chat bar and we'll follow up on that. Okay. Just go back to the frequently asked questions and see what other information I can share with you at this point. Okay, so looking at the frequently asked questions, we've talked about and answered and shared the answers for all of them as part of the presentation, or just by me reviewing those there with you today, as we've been waiting for other questions to come in through the chat bar. So I'll just reiterate again how you can contact us. So firstly, you can visit our website. We're more than happy to receive any written confirmation from you as well, so you can write to us. That will be great. We have the email address, so se.wales.vascular@wales.nhs.uk, and also the phone line, which is 02921 836 068. And if you did want to see the information that any of the organisations involved are sharing on social media, then we are using the hashtag SE Wales Vascular on social media. So I'll just open it up again. If there's any questions, thoughts or comments that you want to share with us at this time, please do so. So yeah, we're still here waiting for any questions that you might have. I'm more than happy to answer them if you do have any questions at this time that we haven't picked up already as part of the presentation. So I'm just going to sort of open it up now really and sort of say final opportunity for questions, because we haven't had any for a few minutes. So I'm going to give a couple of minutes now for the final opportunity for any questions as part of this event, and then we'll close off the event for today. Okay, so it doesn't seem like we've had any final questions, so we're going to round off the event for today. So firstly, thank you for taking the time to join us. We really appreciate that you have taken the time to join us and have this conversation with us today about the South East Wales Vascular Network. As I said at the start, this has been recorded, so we will be able to share this recording for others to access, should they want to do so that weren't able to make it today to see the information. We do have a second event as well, which is taking place on the 23rd of March, and that event is in the evening for those who would prefer to access the information and speak to us in the evening. So that's an evening event that's starting at 6 p.m. and all of the details of that are on our website. So if you know anybody that wasn't able to make it today that would want to make it, please share that with them. And all further information about this can be found on our website as well. We've got the email address that I've mentioned and also the phone number. So please get in contact with us if there's any questions that you wanted to share, or comments or reflections that you wanted to share with us. But apart from that, just to say thank you very much for joining us, and thank you to all of the panel members that took part in the event today. It was great to have you with us.